But you were telling me about the relationship with your girlfriend.
Yeah.
Tell me a little bit more about that.
Private practice gives you a lot of flexibility. I guess if you're, have a need to be in control, it gives you the most control, where you can make your own schedule, and also meet patients' needs, because in child psychiatry, kids are at school during the day. And in private practice, I can do very early in the morning or after school hours. And I found that to be the most helpful.
And I think the police...
And it can be scary sometimes if you go into a private practice alone. That can be isolating. You need to have someone we can bounce ideas off of. And I found that in a hospital setting is a great way to really start a private practice, because there's always going to be a colleague around where I can sort of do a curbside consult every now and then.
Any agitation?
The ER is its own beast. You have to pretty much be ready for anything.
We have a patient roommate that you need to see. He was intoxicated.
Okay.
Alcohol level at the beginning was 400. Came in yesterday. So went out.
The reason why we call it the crisis intervention unit where I work is because there's always a crisis.
This morning, it's down to
And I really wanted to help someone where there was that snapshot, or that real small area where there was that area where they needed help immediately, and really to get them placed in an appropriate setting.
Have you ever been in any substance abuse programs?
My focus is mainly adolescents, working with kids, say, in the middle school range, and working with them all the way through high school. Seeing kids go from, I guess, a difficult situation to the point where they're actually graduating, good grades, functioning well in the community.
We've been there for 2 months.
My biggest goal in life is to help people get through all of that and also see them progress. And I think the flexibility I have in the practice is that I can use medication or use therapy.
Okay, so I'm gonna give them a call and see and give them this insurance covered and everything.
As a child psychiatrist, there are many challenges, just the sheer volume. You know, there was a study several years ago that talked about the need out there for psychiatrists, especially child psychiatrists. For us to actually meet that target, each child psychiatrist would have to cover around 4,000 patients.
Okay, so I'll give them a call and see if we can get them in.
Excellent, excellent.
Through the Maryland Psychiatric Society, I've been able to meet a lot of mentors. They do a lot of outreach with psychiatrists. They also do a lot of outreach with people in the community. So through the APA and Maryland Psychiatric Society, I've been able to make a lot of connections, which helps me in my private practice, and especially in the emergency room.
What is a psychopath? You're a psychopath.
I would encourage a lot of the residents out there to go into child psychiatry. You get to see someone developmentally go through all the stages. You get to help families out, and there's a big need out there.
You put a lot of stress on my life.
Especially in the community. I mean, our service to many of the institutions in the area, from schools to residential treatment centers to DSS or Department of Juvenile Services, a child psychiatrist is going to be very helpful as you try to really evaluate patients and get them where they need to go. There's a huge need out there.